Hello everyone. Today's video is about this question. Were you treated this way in your ER emergency room? Before I talk about our ER negative experience, I want to first mention the positive things. We have been going to this hospital and ER for many years, and we wouldn't go anywhere else. Our first choice will always be this hospital and ER. The ER doctor and the nurses that took care of us on April 11, 2024, were all nice, professional, and provided us with an excellent service. Now let's talk about our negative experience. I'm going to tell you the sequence of events on our visit. Please let us know if you were treated the same way when you had to go to your ER. Before I tell you the sequence of events for our visit, I want to mention in our previous ER visits, once we were taken to the ER patient care room, we did not leave that room until we were discharged. But it has changed since then. This time is a completely different process. When we arrived at the ER, we checked in like we would normally do. Then we were taken to the ER patient care room. We waited a few minutes in the room. Then the ER doctor came and talked to us. Then the nurses did what they needed to do, put IV, took blood for tests. And luckily, it was only a small bag of IV. Then the nurse said that we needed to go back to the ER waiting room, I guess, while we get the test results. This is the part that we did not like because, it's not comfortable waiting for hours for the test results in the waiting room. You know, the chairs were not comfortable at all. It's better in the past where, you're more comfortable in the patient care room, lying down on a bed or in a recliner. And we saw several patients in the waiting room with their IVs, and you could tell they're not comfortable. Some of the patients are slouching. We saw a patient lying down on the floor. I mean, to us, this is really not acceptable. It's like I could understand if, we were in a war zone or during the pandemic, but the day that we went there, they weren't even that busy. So, it's just there's no privacy. And with the amount of money that you're paying, you pay thousands of dollars when you go to the ER. The least that they could do is, like let you be comfortable in a patient room until it's completely done, until you're discharged, instead of doing that. So after, I don't know, a few hours of waiting in the waiting room, we were taken to a discharge station area that they have created, which is they had a line of chairs. Every two chairs, they had like what looks like a plastic divider dividing every two chairs. And the bad part about this is the discharge station where that they have created is right by the entrance exit of the ER where everyone goes in and out. So, and once the test results came back, the ER doctor came and talked to us in this discharge area where people are going in and out, really, where the entrance and exit is. So someone we know could pass by while the ER doctor is telling us our diagnosis. They could hear it. We could hear the diagnosis of the person next to us with only this plastic wall separating us. How is this HIPAA compliant? To us, this is not right. I think they should keep you in the ER patient care room until discharge, or at least create a discharge station in a more private area where there's privacy. Let me know in the comments if you had the same ER experience. I'm curious to see if this is something new that all ERs in all facilities, different facilities are doing now, or just this ER department. That is it for today. Until next time, bye. Thanks for listening.